Mini lecture on managing health information, strategic planning, and architecture. This is the second in a 3-series presentation, and for this particular mini lecture, the focus is going to be on strategic planning. I'm going to present a couple of strategic plans, and there's a purpose behind that, and that is to get you straight into trying to understand how a strategic plan looks like. So I'm going to present you strategic plans at an organizational level, and then we'll go down to the more of the strategic ICT plans. So we're going to start off with the Department of Health strategic plan from 2012 to 2016. And as you can see, well, first of all, before I start, I just want to inform you that these strategic plans, they are PDFs, and they are in Blackboard as well, because some of the words here tends to be really small. Alright, back to the strategic plan from the Department of Health. So as you can see here in front of you, there are a couple of sections which is quite common across the board for most strategic plans. And keep in mind that these are organizational strategic plans. These are big overall plans. So we have vision, so in this case quality healthcare that Queenslander value. There's a purpose behind the plan. There are values, and values are really very important. So at the moment we have 4 values that's important to the DOH. There's also objectives. There are outcomes. There are also strategic risks that is associated with a strategic plan. There are performance indicators or KPIs. And on the following page, the strategic objectives are made clear. There's 6 of them. So the first one is to facilitate the integration of health system services that focus on keeping patients, people, and communities well. And then on the right hand side, or the middle part of the page, you see the same 6 strategies again, but this time below each one of those objectives, what I call, I guess, the action points. So that's more or less the structure of how a typical strategic plan at a big level, at the highest level, will look like. And hopefully when we go through the next couple of plans, you will see that it's sort of a cascading sort of a structure to it. Always start off with the vision, and then there are values, and then there's usually objectives, and then action points, so on and so forth. So following this plan is the Gold Coast Hospital and Health Service Strategic Plan for 2013 to 2017. Now keep in mind now that we're not talking about ICT strategic plan. We're just talking about strategic plan at the organizational level, of which ICT plan is just part of it. As you can see on this page, it talks again about the vision at the Gold Coast. It talks about why are they, what's their business all about, which is about serving the community, trying to maximize their opportunities so that they can serve their communities, and how they actually engage with the community and the staff. And also notice there are values, and these values should be aligned to those values from the previous strategic plan, because we're all really part of the Department of Health. Now what's interesting is the next 2 couple of pages. And I think they managed to squeeze a lot of information at this stage over here. At the upper left hand corner, they have a vision. So the vision is the Gold Coast Health will, through innovation and patient-centered care, become a world-class provider of public healthcare service. They also have values. There's 6 of them, 6 values, as you can read on the screen. They also have the Queensland the strategic goals for health, and there's four of them. And along with that comes the Gold Coast Health Objectives. So as you can see, there's a bit of a cascading structure here. Now what's interesting here is if you can zoom down into the Gold Coast Health Objectives, there are 1, 2, 3, 4, 5, 7 of them. And on the, I guess, the vertical part of it, if I can bring my cursor over here, you probably can't read this, but what it says is, we will achieve our goals by doing these things. So these are more or less the action points, and the whole idea is to have these action points to fulfill this particular objective over here. And as we move down here, I'll read this for you. We will measure our performance through. So these are all measurements, again, to fulfill those objectives. Over here it says strategic risks. So the Gold Coast Hospital and Health Service has identified strategic risks which corresponds to each one of those objectives. So hopefully by now you have a sort of an idea of how a strategic plan looks like. There are structures to it. There are headings that you would normally see on a strategic plan, and this cascading structure which will become quite apparent later on. Now let's look at an actual ICT strategy and an action plan. This is from the Queensland Government, 2013 to 2017. This is more or less, it's like an action plan. Again, this is a PDF, and it's in Blackboard as well. So again, the vision is for a transformed public service that's focused on improving services for Queenslander by better use and analysis of government data and by using modern cost-efficient technology. So keep in mind that this is an ICT strategic and action plan. So what they have come up with is 3 objectives. Number 1, effective digital services for our clients. Number 2, efficient digital services for the government. And the third objective is to transform and a capable workforce. So again, the time frame is pretty important. It is between 2013 to 2017. Now I like this diagram, and I sort of put it here because it tells me that they have done a bit of their homework. And the whole idea behind strategic plan is, again, to understand your business a little bit better. So over here they have actually looked at the citizens and the business in terms of looking at what their requirements are, because their requirements will actually sometimes drive the plan. So for example, over here where we have a citizen who wants I want a hassle-free way to deal with government whenever and wherever I want to, even from my mobile. So that's a pretty cool requirement. We also have requirements from the business community. For example, this guy over here that says my business can only become more profitable if I use ICT to reach my customers. So again, these are more like a good understanding of their requirements. Now, and cascading down from there is these are the 3 objectives that we were looking at just now. And what they have done is for each one of those objectives have focus areas. Focus areas. So we have 6 focus areas for the first objective. We have 4 focus areas for the second objective, and we have 2 focus areas for the third and final objective. And some of these focus areas are quite topical. We have sort of talked about them before. Improving customer experience, yes, that's always required. Getting into the digital economy is a focus area for not only the government but for other industries as well. information management. The reason why I have it sort of blocked off in with that red block is because I'm going to expand on that in the next slide. Focus area number 4 has to do with data, making sure that the data is more open. Number 5 has to do with information security and privacy. Number 6 has to do with where do we keep our information, which is archiving of digital assets. Number 7, which is fairly new and is talked about now, is contestability and ICT strategic sourcing in the hospitals. They are really getting into this in a big way. Number 8 is ICT as a service. Number 9 is innovation. Number 10 is looking at risk stability. Number 11 is looking at the workforce now, trying to be more responsive and competent. And number 12 is looking at more of a projects, program, portfolio management kind of skills and knowledge. So let's focus a bit more on information management. So keeping in mind that this is from the Queensland government, it is their ICT strategy. So in terms of their focus area in information management, where they are now is limited sharing of information between government departments and community, but where they want to go to is to share the information, to have better accessibility, and to increase interoperability between themselves. And again, this is what the healthcare is going through now. At a glance, essentially what they're trying to achieve is to develop an information management blueprint for the government to increase accessibility and visibility of information across all departments, and to increase the consistency, the management of information across the sector. They have also written a paragraph describing their business drivers, and again, this is it's all to show that they do have a good understanding of what's happening. So for example, they understand that information across the Queensland government is not shared readily or effectively between departments. This results in duplication and excessive cost to create and manage information. They also realize that the inability to access and reuse data reduces public confidence in the government, transparencies, accountability, so on and so forth. They have also presented the investment objectives over here, but I think more important is down here, where it's more related to the business benefits, and this actually impacts us as citizens and as the users of the healthcare, the Queensland government. So some of the benefits include improved accessibility to information, improved time to retrieve data, increase understanding of the economic value of information, to enhance capability to share information, to enhance collaboration, to improve comparative benchmarking, and this is the area of performance management, to improve confidence in the Queensland government, ability to deliver services, and to them that's pretty important, to reduce operational and capital costs, and overall to reduce costs to deliver services. So these are all benefits related to the business, and these ones up here are objectives. Zooming down again on the focus area on information management. So what I've come up with is 8 challenges related to that particular area of information management, and they have also come up with 8 corresponding action points. So over here, so the challenge here is the sheer quantity of data collected across government can no longer be organized and accessed using conventional practice. So what's the action? Action number 8 is to pilot a whole of government information search capability. So that's the action point. The outcome is really about running a pilot to understand how decision making can be improved through better analysis of data using contemporary processes and technology, keeping in mind that this is an ICT strategy and action plan. The completion date is targeted for October of 2014, and this is the group that's accountable. All right, and again, hopefully there is this cascading structure that starting off with a mission, a vision, and looking at some of those areas that they're looking at, objectives. They're looking at some of the benefits from it, and then comes down to some of the strategies, and then the action points. Now, let's look at the last case here. It's a lot of words here. It looks really busy. But this is the Department of Community Safety, DCS. This is the ICT Strategic Plan 2009 to 2013. So this is past, but it's okay. So let me just not read through every single word here, but let's pinpoint some of these key areas in terms of this their presentation of their specific strategic plan, which is across 2 pages. So what we have here is the Department of Community Safety focus areas. So they have identified their focus areas, which is good. They have also informed us that they are a big group, so they have different components. So DCS consists of the Queensland Fire and Rescue Service, Queensland Ambulance Service, the Emergency Management Queensland, and also Queensland Corrective Services. And they have also identified their priorities in terms of their business. So this is a good start. On the next page, they have also identified their business drivers, and this was seen in some of the previous strategic plans, and also some of the external factors or influences that will impact their plan. And together that drives all these things here at the bottom, which is the ICT program. So these are the things that they do run in terms of programs or initiatives or activities. And it is grouped by the, for example, up here, down here, let's say Queensland Fire and Rescue Service. These are sort of the programs that and activities that they have running or going to be run. Alright, so hopefully by now it's sort of this structure sort of forms this thing in your head. So let's look at a couple of slides which sort of just wraps this up. ICT strategic planning. There are really 2 types of, in terms of ICT, there's two types of plans. There's a strategic plan, which is the highest level plan, and there's an operational plan. Now let me start with an operational plan. So the operational plan is a smaller plan. It is more, as the word suggests, it's operational. So it's more of the action flowing from strategy to actual implementation of those strategies. They do provide more details for obvious reasons, more specific timelines, and more priorities. It's more of an annual IT plan if you look at it that way. So it's an operational plan. They also have a strategic plan, and this is usually for sometimes 3 to 5 years plan. And the key point here is at this level, it tends to it must align the activities that they're going to work on with the organizational strategic direction. Now, planning is critical, and I don't think I have to emphasize that more. So again, I want to emphasize the point that ICT planning have to align with the organizational direction. So to give you a real example, we looked at the Gold Coast Hospital and Health Service strategic plan, and a lot of those actions from there, a lot of those strategies from there have to align with the Department of Health's strategic plan, and that's what alignment means. Okay, the whole idea behind that is to make sure that the ICT investments are really good investments. Alright, the information need of the organizations are met at that level, and also to maximize overall benefits to the organization. So in my example, that organization is the Department of Health or Queensland Health. So some of the features of the plans that we have just gone through, you would have seen statements of goals, strategies, objectives. You would also have seen missions and visions, those sort of statements. You would also have been exposed to the different requirements. Each of the plan also has a scope. In other words, this is what this plan is for. It's not just about systems and technologies, it is about the overall management of information. Some of these plans also do present their processes in terms of what they do. They also have, to be able to do that, they have to engage a lot of the organizational units. There's also within some plans the identification of internal and external relationship between the entities or the stakeholders. And sometimes there's a bit of description on the processes and the relationships between each of these groups or systems. So it's a big thing, isn't it? A lot of things involved in a typical ICT strategic plan. So this picture here again is the whole idea is to show some form of a cascading structure where we start off with a mission statement or some vision, and that drives the goals, and the goals will then drive the plans. And within the whole organizational or corporate strategic plan, there are many plans, and one of the plans is the ICT strategic plan. So this sort of gives a sort of a context to the whole discussion here. So strategic plan is usually, as I sort of mentioned earlier, is a highest level plan. It's usually 2 to 5 years, but I'm seeing a lot of 5-year plans now. I think that's more common. There are updates to the plan. It's just not a document that you just write and just put away. It is a living document, and people do read it. And usually the time to complete this plan takes from any time, according to Conrick, from 3 to 6 months and even longer. So the planning process itself requires a lot of commitment at the organizational level. It's you got to set up steering committees, which consists of usually senior management people, the users who are the patients, clinicians. You got to include the people from the clinics, the clinicians here. So there's a fair bit of organizational commitment from all the different areas within the hospital or within the organization. You also need resources to facilitate the process of the plan itself. The resources are internal, and the whole idea behind internal resources or using internal resources is to avoid extra expenditure, and usually they are there for a longer period. That's why they tend to understand the whole situation in an internal sort of a view. Sometimes in the process we also get external consultants in, and it's a good thing that you do that sometimes, because they tend to look at it from an external lenses. They have their own experience, and they have their own tools, strategic planning tools that could help. So I'm going to finish off by giving you a really generic sort of a 5-stage process in terms of the strategic plan. First of all is to start the plan, is to initiate the project, is really to set up a really strong steering committee, and as I said earlier, consisting of members from all the different stakeholders. To establish a project team, which is headed by the project leader or the project manager. And basically at this stage is about collecting information, trying to understand your business better, trying to understand what the current issues are and where you want to go to. The second stage is to do the analysis. This is where you try to understand your business direction a little bit more. Again, looking at vision, missions, goals, objectives. You also need to know an assessment of your current situation, an assessment of the opportunities there are, and at this stage what I usually do is to, or a lot of the CIOs would do, is to come up with a SWOT analysis, strength, weakness, opportunities, and threats for technologies in terms of the area, and actually to start to document this in sort of an ICT strategic plan. The third stage is to, as you can see here, is all about developing and gathering those requirements, and this is fairly important. So at this stage in the hospital environment, you will want to go down to all the service lines, to all the different groups, to all the different departments, and ask them what they want. And in any organizations, that's the same. So you try to develop some of the application requirements, system requirements. You need to maybe there's some changes to the data, so some new data requirements, perhaps some technology requirements that could be coming out from some of the groups, even some and start to develop a picture of these requirements, and to actually sign off. And the whole idea behind this gathering and documentation of these requirements is so important is because you need to set up a budget, so you need to know what requirements are so that you can set up a budget. The third one is to develop the plan itself, and here is where you actually write that document where you outline all your initiatives, your activities. You need to identify the relationships between all the different entities, the groups, the shareholders. You need to prioritize, and you use criteria to actually prioritize your activities or your actions. This is where you can get into, I guess, into a little bit about benefit realization as a criteria-based approach. You also start to rank them, and you will have to select at a certain point, these are the strategic IT programs that I want to work on because these are the most important ones to my particular organization. And then you start to finalize your strategic plan document. The final stage is to activate it, and that is to, once the document is written, there's a number of sign-offs already, but the final sign-off is, or perhaps close to the final sign-off, is an endorsement from the steering committee. And then after, when that is signed off, you communicate the strategic plan right through your whole industry to all the staff and all the different stakeholders. And you do this in different ways, using different communication modes. Like you can do it from email, you could use your intranet. A couple of ways to do this, have forums, so on and so forth. This is the end of the mini lecture on strategic planning.